I want us to cross over to the Coast Region and speak to our reporter Tobias Chanji. This is with regard to the state of health in that particular region during this strike. Tobias, good morning. Bring us up to date.
Well, a very good morning, Fatia. Indeed, in an effort to stop the ongoing national-wide doctor strike, we saw last night the government trying to talk to the doctors in a stalemate, which of course we know what happened, and the doctors are adamant that this strike, which is on the 9th today, will proceed, or rather will go on. Our checkup in most of the public hospital has shown that the situation is still dire. Some of the patients in critical condition have been to be turned back. But maybe to just tell us more on this situation and who will blink first, we are joined by the national chairman of the KMPDU, that is Dr. Abidan Mwachi. Maybe to explain for us what happened last night and what is the way forward, Dr.
Thank you. My name is Dr. Abi Mwachi, the national chairman of KMPDU. Yesterday, our negotiating team was patient enough to listen through what we thought were counter proposals from the government side. However, the report that was given was that out of the 19 issues that the doctors thought fit to walk out of this essential service, the counter proposals came to near zero. What was met and what was intention by the team from the other side were threats, intimidation, and if there was anything that was less than that, it was near threat and near intimidation. What you would like to say is that this is not a battle of wits about who will blink first and who will not. This is a battle about who will do the right thing and who will sit on their able hands while Kenyans are suffering and dying. Doctors are willing and able to walk back to their workstations and continue the work, provided that the government understands that this particular strike is not a strike to issue promises upon promises that were issued before. This is a strike about implementing the promises that were given in 2017. However, the cry that the doctors' union wanted the issue solved in its immediacy falls on deaf ears, because how immediate can it be when the issues to be implemented were actually bargained and collectively agreed upon in the year 2017. 2017, 18, 19, 20, 21, 22, 23, 24. Those are many years. So it can be an issue of immediacy. It can only be an issue of a government that does not set its priorities right. And by government, we mean anyone who has been able to run this government. As unions, as a union and any other union, we are blind to politics. What we know is the country has to be run by systems and structures, so it doesn't matter who is in office, it doesn't matter who was in office in 2017, all the other systems and structures must run as per that time. We also don't envisage a position where a new government comes in and throws our CBA into the garbage pit, and now expects us to renegotiate a new CBA. That will not happen. For all intents and purposes, we intend that this be the strike of the decade, the last one. So we will not go in and out with empty promises. That was belittling us and punching way, way, way below our weight.
So is it threats or delaying tactics? Because we've heard from the governor of Nairobi who said that doctors will not return back to work, will be sacked. And at the same time, we've also had the cabinet secretary in charge of health, while appearing on KTN News, saying that there are those interns who are willing to work for free.
I will pick, addressing the latter, then the former. I will pick a phrase I picked yesterday from the media, that the cabinet secretaries should not confuse despair for generosity. Those doctors who are willing to work for free are actually enraged, and they have already been consumed by despair. So it's not a good thing that that's happening. Secondly, those doctors who are willing to work for free can actually afford working for free. So by extension, what that means is this country is continuously moving away from the narrative as a country for average and lower people to a country of the who is who. Children are born with silver spoons in their mouth. So that was actually a very sad thing and bad thing for the cabinet secretary to acknowledge. while giving us a glee on national media. Honorable Sakaja is excellently Honorable Sakaja. If you feel that the doctors have really, really aggrieved you, don't give us 12 hours. Do it immediately. The doctors are ready for you. Sack us now, not tomorrow. Don't need 12 hours.
So lastly, how long will this go?
The only thing that will cut this stalemate is not counter promises over the promises we already had. When the interns posted, as per the CBA, we want the collective bargaining agreement of 2017 fully implemented, which one of its key tenets is the implementation of the basic salary, where doctors negotiated a measly pay rise, and the government has sat on with the arrears from 2017 to now, so we want that money paid. So I can't say in 10 bounds, but I can promise you, we are not going on strike again. So you can guess how long this will take with a lackluster, cavalier, lackadaisical approach from the government.
So, thank you, Daktari. There you have it, Fatia. That is Dr. Abidan Mwachi, who's the chairman, KMPDU, just painting for us a picture of the situation in the entire country. As you've heard him, he says they are ready even for the sacking. Back to you in studio.
Right, Chanji, thank you so much for that. Of course, that is with regard to the doctors' strike happening in the country.